Hey there, fellow adventurers. If you have ever wondered what to do in case of a snake bite, you are in for an informative and crucial journey today. In this video, we'll be delving into the world of snake bites and discussing the essential steps for effective management. So, stay tuned because by the end of this video, you will be well equipped with knowledge that could save lives. So, let's start. There are about 400 species of Indian land snakes and 30 species of Indian sea snakes. Of the land snakes, 40 are poisonous, and of the sea snakes, 29 are poisonous. The common poisonous land snakes are the cobra, Russell's viper, saw-scaled viper, green pit viper, and krait. The first two are responsible for most of the deaths. Then comes the first aid management. First one is reassurance. The patient must be reassured that every snake bite is not poisonous, and even if poisonous can be successfully treated. Second, immobilization of the part. The affected part must be immobilized in a functional position by a splint and application of a crepe bandage to reduce the rate of spread of the venom. No incision or suction is recommended now. Third, tourniquet. Only in cases of krait bite. The site of bite should be lightly wiped by a clean cloth, and a band of clean cloth like handkerchief 2 to 4 centimeters wide should be firmly tied 5 centimeters above the bite. The tourniquet should be tight enough to occlude the lymphatics but not the arterial or venous circulation. It should be released every 15 to 20 minutes for 1 to 2 minutes and reapplied just proximal to the advancing edematous area. Fourth, transport. The patient must be transported to the nearest medical center. The snake must be identified and preserved. If it is dead, it should be carried to the hospital along with the patient. Now comes the medical management. On admission in hospital, an intravenous line should be established, tetanus toxoid administered, nursing in a lateral position continued, and an anxiolytic drug given if required. Second, mandatory observation of the patient for 24 hours for signs of systemic envenoming is required, since krait bite victims sometimes show delayed onset of signs. Third, anti-venom therapy. This is a life-saving passive immunotherapy which would be effective only if the venom is circulating in the body and has not fixed to the tissues, resulting in specific toxic effects. Polyvalent anti-venom should be given intravenously for its maximum effect within 24 hours of the bite. It is most effective within 4 hours, of less value after 8 hours, and of questionable value after 24 hours. The dose of the antivenom depends on the amount of envenomation. Fourth one is antibiotics. Broad spectrum antibiotics like ampicillin, chloramphenicol, or tetracycline 250 mg 4 times a day may be given to check infection of the devitalized part, especially in viper bites. Fifth, fluids, electrolytes, diuretics, pressor amines are used judiciously for management of hypovolemia, fluid overload, and cardiac complications. Sixth, analgesics. This may be required for pain. Aspirin 300 mg 3 times a day with antacids may reduce the pain. Seventh, blood constituents. In hypovolemia, plasma, its substitutes, or albumin may be given to expand plasma volume. Red cells lost due to lysis or bleeding may require packed cells or whole blood. Eighth, antihistamines, adrenaline, and steroids. They have to be available to manage anaphylaxis or allergic reaction occurring due to the administration of antivenom. Now, specific treatment. First one is neostigmine. In cobra bite, 95% of the offending toxins produce neuromuscular block, resulting in paralysis, which is reversed by neostigmine. Neostigmine should be given as soon as the neurological signs appear and should be continued till complete neurological recovery. Premature discontinuation may lead to a relapse. This treatment is not only highly effective but also completely safe as there are no side effects. Heparin and coagulation factors are not recommended now. Human fibrinogen 300 to 600 gram is given intravenously within the first 24 hours of treatment after effective control of clotting. Now we have the treatment of complications. First one is shock. Hypovolemic shock is best treated with 5% albumin, which is superior to glucose or saline solutions. Dopamine and corticosteroids are used if necessary, and electrolyte disturbances, if present, are corrected. Second one is acute renal failure. Oliguria and hematuria are the earliest signs. It is treated by restoration of fluid and electrolyte balance. If renal shutdown occurs, hemodialysis may be required. Third one is respiratory failure. Respiratory muscle paralysis leads to respiratory failure with resultant hypoxia and hypercapnia. This requires ventilation with a respirator or ambu bag, that is, artificial manual breathing unit bag, and proper control of blood gases. Thank you for joining me today to learn about snake bites and how to manage them. Remember, knowledge is your best defense against these encounters in the wild. Stay safe out there. Again, thank you for watching, and don't forget to like, subscribe, and share it with your friends.